You know, some molecules have a kind of split personality, and a perfect example is this one: 3,4-methyleno-dioxymethamphetamine. Yeah, it's a mouthful. You probably know it as MDMA. And this one chemical is living a serious double life, sparking everything from huge parties to some really intense scientific debate.
So, on one side of the coin, you've got the engine of rave culture, right? The street drug we all know as ecstasy or Molly. It's synonymous with euphoria, dance parties, the whole scene. But then you flip that coin over, and it's at the absolute forefront of psychiatric research. We're talking about a potential game changer for treating some of the toughest mental health conditions out there, like PTSD. So, that's the big question, isn't it? How can a single chemical be both a party drug and a potential lifesaver? I mean, think about it. How does something that's legally in the same box as heroin also get breakthrough therapy status from the FDA? It seems like a total contradiction. So let's dive in. We're going to unpack the science, the history, and all the controversy behind these two very different faces of MDMA.
All right, so to really get MDMA, we've got to start with its identity crisis. And it has a big one, both on the street and in the eyes of the law.
It goes by a lot of names, right? Ecstasy, Molly, X, E, but chemically, it's that long one again, 3,4-methylene-dioxymethamphetamine. And what's really interesting is its family tree, chemically speaking. Its structure is kind of related to stimulants like amphetamine, but also to hallucinogens like mescaline. And that little fact right there, that helps explain why its effects are so unique.
Okay, now for the legal side. In the US, the DEA puts MDMA in a category called Schedule 1. And let me tell you, that is the most restrictive category there is, period. To get that label, the government has to decide it has a high potential for abuse, absolutely no accepted medical use, and that it's unsafe even with a doctor watching. This puts it in the exact same legal box as heroin and LSD. And you can imagine that creates some massive, massive hurdles for any scientist who actually wants to study it.
So, with all that legal baggage, what is this controversial molecule actually doing inside our brains? Let's get into the neuroscience.
You know, scientists actually came up with a special word for drugs like MDMA. They call it an entactogen. And if you break down the Greek roots, it literally means to produce a touching within. How cool is that? So this isn't just about feeling good. It's about something deeper, fostering introspection and empathy. And that's really what sets MDMA apart from a regular stimulant or a classic hallucinogen.
Okay, so how does it create that touching within? Well, the main trick is a massive, and I mean massive, release of serotonin. So picture this. You've got these little pumps in your brain called serotonin transporters. Normally, their job is to pull serotonin out of the space between your neurons. But MDMA comes along, hijacks those pumps, and flips them into reverse. So instead of sucking serotonin in, they start spewing it out. It's like opening the floodgates. And this absolute flood of your brain's own social bonding chemical, that's what creates those hallmark feelings of empathy, connection, and just less social fear.
But a flood like that doesn't come for free. It comes with a cost, or at the very least, a huge scientific controversy. And this is where we have to talk about the big, scary word, neurotoxicity.
First off, let's be clear, the short-term risks are absolutely real and we know about them. MDMA can cause your body to dangerously overheat. That's hyperthermia. It can cause a super rapid heart rate, dehydration, and if you take too much, you risk something called serotonin syndrome, which is a life-threatening condition from way too much serotonin activity. And here's the kicker. All of these risks get cranked up to 11 in the exact environment where it's often used, a hot, packed dance club where you're moving for hours.
Okay, so that's the short term. But what about long-term brain damage? This is where the water gets really, really muddy. In animal studies, it's pretty clear. You give rats or monkeys high doses of MDMA, and you see a loss of serotonin nerve endings in their brains. But when you look at human studies of recreational users, the findings are all over the place. Yes, some heavy users show problems with memory and attention, but it's just not a simple, clear-cut case of drug causes problem.
So why is it so messy? Well, think about it. It is almost impossible to study the effects of just pure MDMA when you're looking at recreational use. For one, the Molly or ecstasy someone buys on the street, it's often cut with who knows what. 2, people who use it often use other drugs too. 3, the rave environment itself, like we said, adds its own risks. And finally, and this is a big one, it's really hard to know if someone had memory problems before they ever started using MDMA. You add all that up and the human data becomes an absolute mess to sort through.
But here's the twist.
The very same brain-altering effects that cause all this controversy, they're also what has put MDMA right at the center of a potential revolution in psychotherapy, especially for one condition, post-traumatic stress disorder, or PTSD.
And the theory behind it is, well, it's pretty powerful. If you have severe PTSD, just thinking about the traumatic memory can feel like you're living it all over again. It can be re-traumatizing. What MDMA seems to do is temporarily dial down the fear response coming from the amygdala. That's your brain's fear center. This creates this incredible, unique therapeutic window. It allows a patient to actually look at those painful memories with their therapist and process them without being totally washed away by a tidal wave of fear and anxiety.
And this isn't just a fringe idea. The clinical data has been so promising that back in 2017, the FDA, the U.S. Food and Drug Administration, took a look at the early trials and gave MDMA breakthrough therapy status for PTSD. Now, that's a big deal. That's a special designation they save for drugs that look like they could be a huge improvement over anything we currently have for a serious condition.
It is so important to understand this, though. This is not about just handing someone a pill and saying good luck. It's called MDMA-assisted psychotherapy for a reason. It's a super structured process. First, there's a ton of screening and prep work. Then comes the actual MDMA session with a single, pure, precise dose in a totally safe and controlled room with 2 therapists there the whole time. And then, afterward, the patient has more therapy sessions without any drugs to help them process and integrate everything they experience.
So where does all this leave us? Well, the future of MDMA might not actually be about the molecule we know today. It might be about, well, splitting it in two.
Okay, this is pretty cool. Think about your hands. They're mirror images of each other, right? They're almost the same, but not quite. Well, the MDMA molecule is like that. It exists in 2 mirror image forms called SMDMA and RMDMA. And this is where it gets really fascinating. Scientists are discovering they do totally different things. The S version seems to be the troublemaker. It's the one that causes most of the negative stimulant effects, the body temperature increase, and maybe the toxicity. But the R version? That one seems to be the hero. In animal studies, it delivers the good stuff, the empathy, the reduced fear, with way fewer risks. And that discovery, that could open the door to a future where we have a much safer, much more targeted version of this drug just for therapy.
And so that brings us to the ultimate question, doesn't it? MDMA is standing at a major crossroads. On one path, you have its undeniable therapeutic potential, something even government regulators are acknowledging. Could that open up a whole new era of psychedelic medicine? But on the other path, you have its controversial history as a street drug. Could that reputation create such a backlash that it slams the door shut on all this research? Some scientists are genuinely worried it could lead to a second dark age for the whole field. Which way will it go? Honestly, the answer is still being written.